In the standing or seated position techniques, I'm going to have my back towards the camera so you can see my hand contact as I treat the back of the neck. First, we're going to start using a massage stick, rolling pin. So I just grab this. What you could do is try not to have it directly on your neck and pushing it forward. That may be tender on the bony prominences of your spine. And we're not going to do it directly on the side of your neck because, again, it would be too much for the cardiovascular and the bony prominences here. So what we're going to do is place it a little bit on an angle. So I'm doing one side at a time. And I'm just rolling the pin or the stick up and down the neck. Not too much pressure. Going from the base of the neck and moving upwards towards the skull. Now, we could get to using our hands. We're going to use the palm of our hands and the fingers on either side, and you could overlap it with the other hand and then just squeeze on the side of your neck. So basically it's this side here that you're squeezing in towards the midline. So you're compressing on either side. And then you could hold that position and then bend your neck and head forward so that the muscles are lengthening in between your palm and your fingers. Then what you could do is take your knuckles, place it just underneath and back of your ear, and you're going to stroke downward. And as you do, you could rotate your head away so it captures the levator scapula. Then we get back into the back of the neck. You could do a lift and squeeze. So you squeeze and you lift the muscles away. Squeeze and lift. And you can also add in bringing your head downwards as well as your neck. And you could go back using your palm and your fingers. Do a squeeze and lift, and do the same motion with your neck and your head. Next, we're going to use our finger pads. I'm going to use the opposite hand for the neck. I'm going on the neck side. So I'm using my left hand for my right side of the neck. And I'm using my right hand to support the elbow. And I'm doing rotations. From the skull to the angle or the base of the neck. And then with the same hand contact, I could place my fingers right next to the spine. So we did this for the back where it's called Lamina Groove. And we're going to go right into the groove with my fingers. I'm going to hold my fingers there, and I'm going to bend my head and neck forward and relax when I bring my head back. So apply pressure forward and release the pressure when I bring my head back. Do that a few times and then move to a different segment. You can also rotate your head away and pull your fingers while your head and neck are rotating away. The next technique, still using with your finger pads, is place the tips of your fingers midline just underneath your skull, and you're going to press and then slide outward. So it's basically horizontal stroking. And you can also get back into doing fingertip circles. The next position is still with the fingertips. You're going to have it on the side of your neck, just underneath your skull. And you're going to stroke your fingers towards the midline. As you do so, you are going to look away. This will help in the suboccipital region. So nice and slow. Come back and do that again. And then you can use your thumb right underneath the skull. So we talked about that bony protuberance right here in the anatomy. I'm just going to place my thumb directly under it, and then I can move my thumb side to side and circles, staying stationary, then reposition, and have my fingers on the rest of my skull as for a support. And then you can leave your thumb or your fingers just underneath the skull and bring your head slightly backward so the muscles of upper trapezius, semispinalis, and splenius are relaxed. You can get right into the suboccipitals. And you just hold your fingers there until you feel the musculature trying to relax. And then reposition and do the same thing at another spot. Now, if your fingers are not strong enough, you can use a ball. And you could reinforce it with your other hand. Make sure you're bringing your head back as a counterbalance. And then you could also use a hammer with a tennis ball at the head. Bring it around. And you can move side to side and up and down. Side to side, up and down. Now I'm only demonstrating on the right side. I'm not putting the ball directly on my spine. It's just off of the spine. And then at the angle right here, this is where upper trapezius, semispinalis, splenius are, and even levator. You could use the tennis ball on the hammer to capture these muscles. So semispinalis and splenius are in this area right here, along with upper trapezius. Here is more of upper trapezius and levator scapula. So this is the area that we talked about that needs the attention when you are treating the neck area. And these are the techniques to use for the back of your head.